Wow, good afternoon, or it is afternoon. Dr. Clark,
I
our
don't know, we got the
illustrious doctor,
fire
how are you?
going. It doesn't feel like the afternoon. It feels like a cozy night out.
Isn't it a beautiful day? It's fall and the leaves are changing, and I just feel that energy coming. And so we're so excited to be here today with our illustrious leader and captain of this ship. Well, captain of a ship, because we are actually in collaboration with Dr. Clark, who has
Jump ship.
moved jump ship to another ship, but a ship that we like and that we can sail alongside. So congratulations, Dr. Clark, on your new position as Chief Medical Officer at Jordan Health. Let's get ready.
Thank you. I'm excited. I love being back at Jordan. And, I always had a heart for Jordan. I worked there before. And even when I was at Common Ground Health, we always collaborated with Jordan.
Yes,
so there's nothing
yeah.
new. Phyllis is still my boss. Everything's about the same. So, but we're good. And I'm glad to be back together and hope to do a lot more messaging for our people.
Absolutely. And
what are we talking about today anyway?
We are actually talking about breast cancer. So this is a really great topic because there are a lot of things that we're highlighting in the month of October. And breast cancer is one of those. It's breast cancer. As a matter of fact, the walk is on Sunday.
This Sunday.
Breast cancer walk is on this Sunday. And so we've been hearing a lot of messaging around breast cancer. And there is an event coming up at Jordan.
October 22nd. Right.
October 22nd.
Yes. And you are leading. You're our MC. Yay.
Who else could you have but me? You know what I'm saying
here? Immediately,
you feel me?
People are like, do you know Reverend Jackson? I was like,
no.
I do. So it's like, it's good having a celebrity as your boss. But
it's good. I'm trying to be like you, but except I want to be loved. And so we really are excited to have this conversation today because there are a lot of things about breast cancer and breast that we really are not clear about. And so one of the things that I really want to know, Dr. Clark, is that there is kind of going around or in thought that breast cancer is really not as prominent, especially among women of color.
Well, the rates of breast cancer are fairly similar, when we talk about between Black women and white women.
Oh, okay.
Yeah. And it's so common. I think anybody you ever talk to knows somebody who's had breast cancer, right? That's because the rates of breast cancer are like 1 in 8 or 1 in 9. So very common. Most of us have people in our family who've had breast cancer. Now the outcomes are not the same.
Okay, and so that's the difference there.
That's the difference, between races. And I think especially interesting is the age distribution. So a lot of times in Black women, you may see cancers earlier. And in white women, that rate goes way up when they're older. And so that's one of the biggest differences. And I think that has something to do with how easily they're detected and treated. Because all these things, the earlier we get them, the smaller they are, the easier it is to handle.
That's true.
Yeah. So I think it depends on the density of your breasts.
And when you say density, Dr. Clark, what do you mean density of the breasts?
So how thick are your breasts? How much is tissue versus fat? So as we get older,
is that was that shade to me or something?
Well, I just, I didn't want to.
I forgive you because okay. All right.
But the one, there's some things that are hard about being older, but breast screening is easier in older women because our breasts, as we get older, are replaced with fat. So what was breast tissue, there to make milk, gets replaced with fat. But that makes it easier when we go for our mammograms, because when breasts are fatty, it's easier to pick out the cancers as opposed to when our breasts are dense. So when we talk about differences in races, and right now I'm just mostly talking about Black women who have
Huh?
the highest rates of death, compared to white women who are more likely to get breast cancer when they're much older. It's also
Uh-huh.
a time when it's also easier to detect. So,
Why?
but you know, I'm sorry, go ahead.
I was going to say, is this poor outcomes and see it being developed in Black women or women of color earlier? Is that, am I clear? Why is that? I don't
You know,
understand. Is it because we're not, I mean, there's been a great campaign over the last number of years about early screening. And but why do they know why? We say it's really important to young Black women and women of color to get the screening, that they get better outcomes. But the question is, well, if it's in your family, do I really still need to do it?
mhm,
If it's not in my family, nobody in my family has breast cancer, so
yeah,
I don't have a history or any other kind of cancer. So
yeah.
why should I, you know, why is it showing up in women of color earlier, sooner than in white women?
I don't know. You know,
Okay,
I don't know. And I think, you know, when we talk about other cancers like prostate cancer in
right.
men, that's so much more severe, showing up at much younger ages. So we have to
Mm-hmm.
screen younger. It's almost like it's a different set of diseases. And,
Mm-hmm.
you know, the question is, you know, biologically, you know, we're all very close to each other. And
Right.
it leads me to wonder about the experiences in life that influence how our bodies, the cells in our bodies change and grow. And
Mhm.
that's a whole nother show. But we know it happens in younger women who are Black. So we have to figure that out. We have to screen. We have to find things when it's early and easier to treat. You know, once diseases spread, whether it's prostate cancer or breast cancer, it becomes harder. Not impossible, but it becomes harder. So.
So one of the questions too, Dr. Clark, is what age should we start getting mammograms? I know I honestly, I'm going to confess here. I'm thinking as I get older, I'm thinking I don't really need to have mammograms as often. You know what I mean? Even though I feel like my breast tissue is probably non-existent. So, you know what I mean? At my age, what used to be up north is gone south. And so I figure, it kind and I think, I know my mother-in-law once told me she hadn't had a mammogram in 20 years. And I talked to a lot of seniors and they really don't get their mammogram screenings as often. And so from what age do we start and when do we end? Is there a recommendation? I mean, I know insurances pay for that free now. They have cancer services that pay for it free. We've got your event coming up, the mobile mammogram that goes around. Jordan does them. What age do we start our young women getting mammograms?
That's a great question, and it can be confusing. And, you know, similarly with prostate cancer screening, sometimes we have some general recommendations, and then other times you need to have some individual recommendations. So, you know, the United States Preventive Services Task Force has said we should be screening people 50 to 74
Okay,
who are, but those are also, the qualifier is if you're at average risk.
right.
So average risk is not your mom having it, right? That makes you higher risk.
Okay,
You know, so if you have, you need to talk to your doctor. You need to have
okay,
a conversation, because, you know, for instance, I started screening when I was 40. You know, because not only, you know, am I Black, but my mom had breast cancer and her sister had breast cancer and my father's sister had breast cancer. So I have higher than average risk. So I think it's, and unfortunately, it's not always easy to just to throw out a general recommendation. And that's why you need to talk to your healthcare provider to
okay.
make
So that
best
history
decision.
is very important
Very
in
important.
determining what age. So if you have a history, as you say, and I have, my granddaughter's dad's mom just got treatment for breast cancer. Her three sisters died from breast cancer. So she had a test for the gene. She doesn't have the gene, but
Okay.
all of the women in her family have had breast cancer.
Yeah.
So we my granddaughter is young. She's 28, 29.
Mm-hmm.
I want her to have a mammogram.
Mm.
So, because if it's in younger Black women, shouldn't, given her circumstances and our history, which is important, should we advocate, or should she be having this conversation with her physician
She should be
now?
having the conversation with her physician,
Okay.
because the other thing that comes with screening early in these dense breasts are false positives. So you've
Okay.
got to weigh the risk of, biopsies when you wouldn't ordinarily have a biopsy, and, the
Okay.
whole mental anguish with that. So we would never want to give global recommendations on a show like this, but really, taking everything into account, like, how long has your menses been? People who've menstruated a lot longer may have different risks. We talked about family history. We've talked about race. So I think, it's not, there's an art to this. You have to put all that information together to give the best recommendation. But you certainly want to advocate for your doctor paying attention,
Yeah.
and
Okay.
thinking about, different types of screening. And remember, mammograms aren't the only thing. Clinical breast exams are important. I know, the recommendations aren't universal about self-exam, right? But most of us would like to teach our patients to be aware of their own breasts, be able to examine their own breasts and point out when there's a problem.
Mm-hmm.
Because then you go from screening to diagnostic, to making the
Mm-hmm.
diagnosis.
Mm-hmm.
And different bodies have different recommendations. So I'm sure, for instance, the American Cancer Society does promote self-screening, but like my preventive medicine society may not, just based on
Mm-hmm.
data. So anyway, so it's important to have a discussion with your doctor, use all the tools that are available, including your doctor's doing an exam, mammograms when indicated, and then MRIs if something further is needed in terms of investigation. One thing I love about Dr. Ruby Belton is she is excellent with teaching about when different tests are needed, and how you can be knowledgeable when you have a
Mm-hmm.
conversation with your
Mm-hmm.
doctor. And she's one of our speakers at the screening event on October
Excellent.
22nd. So yeah.
I really think that's a missing piece of the knowledge and the understanding of. We used to, when I first entered into nursing, the big thing was we taught every patient, woman patient, to do so. That was one of the key things. Do your every month, do your brand when you do it, before your period, after your period, whatever. So that was one of the standard things that we taught, was women to do self breast exam on a
Mhm.
routine basis.
It doesn't hurt, but I don't
And
make people feel badly if
no,
they
it
don't.
wasn't.
So yeah.
But we taught all women that were how to do them. And so, but we don't hear much about it now. And so most people don't do, a lot of people don't do them anymore. But so I think having someone like Dr. Belton come and have this conversation. And so as many of you that can, get out to Jordan Health, and I have on my Jordan Health t-shirt here today. All right,
I'm still sporting my common ground.
see, that's collaboration. That is love there. That's love. Okay. Come on out and hear and get some more information about breast cancer, the screenings, all of those kind of things, because, I'm thinking that there are new things on the horizon. I went to a tabling event where there was somebody from a company was advocating that you could come to them, and they didn't do a mammogram. They did an echo, some other kind of
ultrasound or something.
yeah, like that, versus saying that it was better. So come out and listen to the expert, Dr. Belton, who's expert in this, and get more information. So one of the things that we always focus on, we know that women get breast cancer, and so men don't get breast cancer. What do they get?
That is not true. And I had a patient I really cared about who actually died from breast cancer. And he was in treatment at the same time as his daughter. And so when he found it, he found it just washing, right? He did not have a lot of gynecomastia, which is a big word for breast tissue. We're more of it than expected. So male gynecomastia is the male breast. Some men, you notice, have it for whatever reason. Some men get it when they gain a lot of weight. But he was not particularly heavy. But in washing, he noticed something didn't feel right. Same kind of story you might have heard from a woman.
Right.
But by the time he was diagnosed, it was metastatic and it had spread. So he had, he fought hard, but he did die of his disease. And he was always one who wanted to tell other men that this is a possibility.
Wow.
Obviously not as often
Okay.
as you see in women, but it is something that occurs. And I think Dr. Belton's going to talk a little bit about that too on October 22nd.
I think that's really important that men know that, and
Yeah.
I think a lot of men don't know that. They never even consider the fact that they might could get breast cancer.
I think they forget or don't know that there's actually breast tissue there. So,
Well,
it just doesn't
we
feel
don't think of
intuitive.
it. I look at guys that have big chests and their muscle is, I think, oh God, that's muscle. You know what I mean? Except if somebody has a little extra weight, you see, they seem to have breasts. You know what I mean? But muscular guys.
Okay, you can stop now.
No, like
she's waiting this off.
bodybuilders, for example. I think
those pectoralis, right? That pectoralis musculature that's on all of our chests. Yeah, no, absolutely.
Okay, so that's what I meant. You know what I mean? And that you just don't think of that in terms of breast, and I don't think men would either. You know what I mean?
Right. So some of that is muscle, but there can be, there's the breast tissue there. Okay. So we are doing, we're really, we have mammograms at Jordan, and we have the Rochester Regional Mobile Mammography Van too. So we're able to do twice as many mammograms as usual. So you don't have to get one breast at Highland and one breast at Rochester Regional. You can take both your breasts to either those. On October 22nd. I'm going to give you a phone number though, because it's always easier to
right
make
there. Go ahead.
You can, when you do it, Jackson, 585-423-5860. So you can make an appointment, but we'll take walk-ins too.
Okay.
So it's important to get your education, have some breakfast.
Do you have a limited number, Dr. Clark, of people that can come in?
Yeah, we're limited to 100 for the breakfast total.
Okay.
That's including, because we're screening men for prostate cancer too.
Oh, wonderful.
Yeah, and we so it'll be good to have the men there so they can hear about breast cancer.
Absolutely.
Too in men. Yeah.
I can't tell you how many breast cancers have been found by men for their wives. In their wives, they felt something different, which is an important thing. So I think to say that men should really know about this.
No, absolutely. Yeah. And women should know about prostate cancer because we support each other. All of us need to support each other. So there's, I think, maximum 35 women who can get screened on the 22nd. So call and make your appointment if it's been a year. You can't do it too soon.
Okay. So is there a cost for this?
No, just you can bring your insurance card. If you don't have insurance, we got you. So.
Okay. And the address is at Jordan Health. For those of you that don't know, Jordan Health Center is on Hudson Avenue right here at School 22.
We're going to be having our breakfast at School 22, and then
breakfast is at School 22, and Jordan
walk across the parking lot to Jordan to have the screening. So
absolutely, this is I'm so happy to have this in this time of year when we're looking at breast cancer and we're looking at other cancers. It's important to educate yourself about things that go on about your body, and so we really appreciate. Now, one more question, Dr. Clark, on your event. What age do you ask for women of a certain age to come, and you're accepting them only at a certain age?
That's a great question. I think for routine screening, we're not going to take, necessarily somebody who's young. I'm going to defer that one, but I do believe it's 40. You should be able to come and
standard, pretty much standard.
But if you're 25 with a lot of high risk, you have to have a conversation with your doctor.
Okay, because I know insurances are start at a certain age and they'll pay for it, free. You don't have to pay for it if you start at a certain age.
Mhm.
Okay,
And
great
if you don't know, we'll
conversation.
ask somebody when we're there. So no
All
problem.
right, because you know what? Dr.
What's
Clark
that?
is there and she knows just about nothing. I mean, everything there is to know. And if she doesn't know it herself, she knows where you can go get the
There you
information.
go. I
That's
know how
what
to
makes
ask
her
for help.
such
Okay.
a great leader. She knows that she doesn't really know much, but she knows people that know everything. And that is the key right there. So we appreciate that. We want everyone to come out to Jordan Health. When, Dr. Clark?
Saturday, October 22nd from 9 to 1. And you know what, Jackson?
Yes.
They're going to have grits. Breakfast will be served.
If there are no grits, I won't be there. Okay.
Right.
Yeah. And don't forget my shrimp or my fish. Okay.
Yeah, that's our stuff's on the side. Yeah. Thank you
This
for,
is
I am so happy to be with you again. And let's
me
do this
too.
some more. We're going to keep doing this. So,
And listen, folks, enjoy this beautiful fall weather. You see the leaves are turning. It's just a beautiful time. Halloween, and we've got a surprise for you on our Halloween show. And see, it's her. If you hear that in your bedroom at night, think Dr. Clark. Think Dr. Clark. And we are just excited to be back with you. And we hope that you will join us again on our coming episodes. Enjoy yourself. Take care of your body. It's the only one you have. Okay.
amen.
Thank you so much. And listen,
Amy.
Oh my gosh, she's our director,
Amy.
our coordinator, our engineer, our everything. And Amy Knapp, thank you. Not Amy.
Thank you.
Thank you. We appreciate you, and we appreciate all of you that are joining in. All right.
See you next time.
Weekend, and we'll see you on October 20th
22nd.
at Jordan Health for your information and screening. Thank you.